As many as 3 in 10 women and people will be sick with an epidural during labour and birth. But how can you prevent it and reduce it? Why does it happen? And what are your top tips? If you were sick with your epidural, leave your experiences in the comments below and what was the best thing for you. There are lots of reasons why sickness happens during labour and birth, and that's partly because of the hormone oxytocin. I've done videos on that before. But with an epidural, there are a variety of reasons why women and people are sick. So the first is the medications that are used in the epidural are local anaesthetic agents like levobupivacaine, for example, and fentanyl, which is an opioid medication. Lots of people are sick when they take opioid medications. You know, if you talk to lots of people about things like pethidine, fentanyl, things like codeine, dihydrocodeine and tramadol, one of the most common side effects of an opioid medication is to have vomiting and nausea with those. Some women and people are more sensitive to opioid medication than others. Now, the second reason is because blood pressure can fall through the floor. So one of the biggest side effects of an epidural is that it basically opens up all of the blood vessels. It causes something called vasodilation. What that does is drops the blood pressure through the floor, and it's why midwives will be monitoring your blood pressure every 5 minutes when that epidural gets sited and gets inserted, because they want to make sure that your blood pressure remains stable. If your blood pressure drops, there are several things that your midwives can do. Firstly, they can increase the amounts of intravenous fluids that are going into your cannula in your hand or in your arm. It's one of the reasons why you need to have a cannula in the first place, so that those fluids can be pushed through very rapidly if your blood pressure drops too low. Sometimes an anaesthetist will give a reversing agent to bring your blood pressure back up. So they can give you sometimes a medication that will bring your blood pressure back up. And sometimes it's as simple as maybe lying you on your side to bring your blood pressure back up as well. And then at some point moving you into a different position so that that block with the epidural is even down both sides. And then finally, there's an increased chance of needing synthetic oxytocin, which does also increase the chance of nausea and vomiting in labour. So what can you do? Firstly, tell your midwife if you are feeling sick or nauseous. Ask them for a bowl. You can also have intravenous anti-sickness medication as well. So if you are feeling really nauseous, really sick, ask them to give you some anti-sickness medication sooner rather than later. Also, sipping fluids little and often, particularly isotonic drinks if you can get hold of them, or alternatively a little bit of sugary squash, can just help to keep your blood sugars nice and stable and also give you the energy that you're going to need during labour and birth. Not all units have this, but some women and people find that sucking on an ice cube or an ice chip or an ice pop of some sort really beneficial as well, and find that that helps to lower the amount of nausea and vomiting too.